Welcome to Sunday Journal. I'm Grady Colleen, the CapeCod.com News Center. This week is National Older Driver Safety Awareness Week, and in Massachusetts, there were 413 fatal crashes involving older drivers from 2019 to 2023. Now, Barnstable County is one of the oldest counties in the country by demographic and makes up the bulk of older residents for the state, so these statistics hit a little bit closer to home for Cape Cod. Among the ways to deal with this uptick, AAA Northeast highlighted exploring public transportation, especially for those for whom it's time to hang up the keys. So today we have Cape Cod Regional Transit Authority Administrator Tom Cahir to talk more about this grim but important topic. Thank you for joining me. Now, you guys have a ton of senior options with more on the way, but is this data something you have seen that you agree with? Can you talk more about older adult mobility?
Well, yes, I do, Grady, and I thank you for expressing interest in this because this is an issue that the Cape Cod Regional Transit Authority has prioritized and taken very seriously for the last several years. I think it was 5 or 6 years ago when we started talking about the demographic you just referenced and the fact that we have more, median age in Barnstable County is significantly higher than anywhere else in the Commonwealth, and indeed higher than most every county in the country, except for several counties in Florida. So we definitely have an older adult population that needs to be prioritized when it comes to senior mobility. And so we did that. Years ago, we initially unveiled a free fares for older adults. We call them older adults now, but I sometimes slip and say seniors, but you know what I mean. And about 6-7 years ago, we went to free fares for all older adults on Wednesdays. And we noticed a little tick up in our ridership, and we marketed it. You know, Kathy is the best at marketing of anyone around, and she knew how to hit the various social media outlets and others to make sure everyone knew of that availability. And then as time went on, we developed a really close relationship with all of our Council on Aging directors on Cape Cod, all 15 of them. So we put an individual here at the RTA exclusively on dealing with senior mobility, and that's Linda Landry, who works here for us. And she communicates with council directors on a weekly basis. Each of the 15 almost every week. And so we know firsthand what their concerns are. We've developed a collaboration with providing vehicles to the various councils. Each council has at least a vehicle that we've leased to them, and many have 2 vehicles that we lease to them. On top of that, we developed a program in-house that would provide a small stipend to the councils to help with gas and drivers and things of that nature. It's not a big number. It's $59,000 a year divided by 15. And the formula that we used was vehicle miles traveled by the vehicles we've leased, population of the community, and one other factor, our ridership. They were most appreciative when I sent out those checks a couple of months ago. In a matter of a half an hour, I received 15 thank yous from various directors because even though it's not a huge number, it's helpful to them. And so that's just an example of our relationship with the Councils on Aging. So this year in the state budget, the legislature provided 2 grant opportunities. One was for free fares for the entire state, and the other was for a digital equity grant that will allow us to, for older adults that are a little fearful or not technologically savvy, who are afraid of our new smart dot process where you have to summon one of our vehicles via an app. A lot of older adults haven't had that opportunity to develop the technology skills yet. So we've applied for this grant, and we expect to hear this week or next from MassDOT, and I'm very confident because the grant was so well put together by our team working with the council directors, and they provided a beautiful letter in support. So when we get that, we're going to have an individual down there that's in real time is going to be able to help these folks that don't want to use the app. And more than 50% of the 220,000 residents on Cape Cod and Barnstable County in the winter are 50 or older or 60 years of age or older. So therefore, that means more than half of our citizens get free fares on Frisk route anyway. But it's an emphasis of paying attention to senior mobility needs, and we're happy to do that.
Mhm. Yeah, that's awesome. It's a tough demographic in that it's like they need it the most, but also just because of the way technology has advanced so fast, it's also one of the harder demographics to reach. So it's interesting to see you guys putting so much emphasis on making sure it's accessible with a dedicated person. Is this something that has been in the wings for a while now, or is this something that you've only been recently seeing the need for?
Well, about 2 months ago, Linda and I went over to the Bonneville Older Adult Senior Center, whatever they call it now,
Hmm.
and I met with all 15 directors. And Linda had mentioned to me that this was an issue with older adults. So I started to look into it and read, and I noticed that it's a problem nationwide. Where microtransit is being introduced across the country, people aren't really savvy with technology. And it's an app that you have to download. It's a fairly simple process, but if you haven't done it and you're not used to it, so I was moved by the fact that all 15 or 10 of the 15 directors said yes in their individual council. There's a concern there. So then in the budget, state budget, the legislature, in their wisdom, recognized that there would be some funding available through that fair share funding that came about last year, the so-called millionaires tax, dedicated to education and transportation. So they thought, well, they'll give us opportunities to get some of that funding. And so we thought that, by seeking some funds for this effort would be a more beneficial opportunity for the transit-dependent public in Boston County. So as I said, we're expecting an award this week, and I'd be extremely disappointed if we don't get it, and I'll be on the phone if we don't get it, because a lot of work went into it, and our council partners who did a great deal of work as well.
That is really interesting. Now, as well, we talk about like for AAA, they mentioned like as you get older, maybe families as they're younger, even when they're in their 40s or 50s, should have conversations about like when is the time to hang up the keys. But immediately I was like, how is that possible on Cape Cod? Just because of the way the geography is, it seems like if you don't have the ability to drive, you can't really do anything. But obviously, you guys have been just hammering that challenge for the past like 10 years now, especially 20 years, with trying to make, driving from Provincetown to say Chatham is already like a huge ask, but going to say like if you need to go off Cape for medicals and things like that, it seems like this has been something that's been a major challenge for a while. Would you agree? Just with the geography of Cape Cod, is it really, it's not really walkable? Like, is there ways you need to have transportation, it seems, in order to be able to retire here on Cape Cod?
You're so right, Greg. I always enjoy talking with you because many of the questions you ask are so germane to the things that we're doing. And I didn't mention that we have a Boston hospital bus that travels up to 16 or 17 Boston hospitals 4 days a week, takes you up there and back for $40 round trip, waits and brings you back the same day. I mean, that's quite a opportunity for many older adults who have confidence in Boston hospitals. Not that the Cape Cod Hospital isn't sufficient, but we're also working on, or at least exploring the opportunity of working with the state to perhaps provide a service from Provincetown directly to the Cape Cod Hospital, with a couple of stops at healthcare facilities along the way, Fontaine and others. But that's very much in the infant stages because currently Peter Pan is providing some sort of service to that effect, but the grant expires soon. And I talked to our general manager along with Kathy, and we both think that, we want to see if the state would be interested in maybe, us providing it. But it's just another example of us recognizing that need. And from Provincetown to Hyannis is the longest stretch of area anywhere in the state where there's no hospital. So 60 miles. So it's something that seniors would be interested in. But the idea that you mentioned earlier, Grady, relative to, when do you take the keys away? I've been in this business for a long time, and in my previous capacity, I worked very closely with the Registry of Motor Vehicles and registrar. And it's a really difficult decision to make because people are living longer. They're living healthier. They're eating better, and so everybody's different. There are people that are invalids at 55, and there are people that are 95 that are running around, running road races. So it's an individual decision that I think states have grappled with. I've looked at different states and what they're doing about that because your statistics that AAA cited, it was real, and that's those numbers are older adults are getting into crashes more often. So we don't have any direct input or oversight on when to take the keys away, but we can provide alternatives as best we can, and I think we do that better than anybody.
For those of you just joining us, I'm Grady Collane in the CapeCod.com News Center, and welcome to Sunday Journal. I'm joined today by Tom Cahir, Administrator for the Cape Cod Regional Transit Authority. We're discussing a recent unfortunate uptick in fatalities involving senior drivers in recent years, but he says that they've expanded a lot of senior options when it comes to their fixed route services, their dial-a-ride services. Now seniors can ride for free on all fixed routes, and he has some other plans for expanding senior mobility on Cape Cod in general. Now back to the conversation. Can I ask a little bit more about what the that route you mentioned before? So were you thinking of just like it'd be a regular shuttle service that just does a regular routine run? So the idea is like you could have your checkup scheduled for that same day. Was that kind of the idea, or was the idea that it's like the Smart Dart program where you'd like request ahead of time, just to kind of just get a general idea of what that Province down to Hyannis route was that you were thinking about? Just something for.
Well, I'm a little hesitant to speak too
Sure.
specifically about it, but I'm happy to tell you what my thought is, and Kathy and I have discussed. And what has gone on for the last decade or more is federal 5311 funds going to an intercity carrier to provide direct transportation from the town of Provincetown to Hyannis, to the Hyannis Transportation Center. Several years ago, we made sure that bus from Peter Pan went to Fontaine and one other facility along the way, healthcare facility, and ended up at the Cape Cod Hospital. I recently learned that I don't think Peter Pan is interested in applying for the continuing of that service. Now, I'm sure that P&B or somebody else will. So that's probably going to be the outcome. But I was thinking if I had an opportunity to speak to the Secretary of Transportation or Tom Schiavone, the Deputy Administrator, I would say if there's interest, I've already spoken with the General Manager, and Kathy communicates with them all the time about could we do something like that? Could we do a similar to our Boston Hospital bus and stop so that people, I think, still in the infant stages in terms of ideas, but I guess one would have to call the day before maybe or some sort of means of making us aware that what the needs would be so the capacity of the bus could be addressed. But I don't know if we're going to do it. We're willing to look at it like we do everything here. Everything is on the table here, and we meet every Monday morning to talk about ways to improve and what we can do better. So we'll keep you informed on that one as well.
Sounds good. Thank you very much. Now, as well, just back to the AAA research, they were talking about, unfortunately, fatalities are up. Mark Shieldrop, who's a spokesperson for AAA, said that in general, just by nature of, fortunately, great health, a lot of people are outliving their ability to drive by roughly 7 years on average. Now, a lot of states, there's been nationwide conversations in general where it's like, well, should there be like a test, like when you reach a certain age, did you have to take your driver's license test again? And it really comes down to like, should there be a mandate to take away keys? But it sounds like the question is more, can you live without a car? And I don't know if that's true for every community, but or possible for every community. But what do you think for Cape Cod? Is it possible to live on Cape Cod without a car at this point? Do you think that the CCRTA is able to provide, as well as maybe alongside with the ferry services?
Well, I think there is. I mean, that's our goal, obviously. I mentioned this morning at another meeting that, when I came here, people used to tell me we had what we called the B bus. It was the same. It was the same as a DOT service, but it was called the B bus. And people used to say, "Oh, Tom, it's great service, but it takes me 5 hours to get to a doctor and home again." And so what we've tried to do over the years is create efficiencies, add new service, keep our costs down, which we've done. And so now I could say, Grady, with full confidence that you can get to anywhere on the Cape now as quite efficiently, via public transportation. And, we did that when we introduced the train 11 years ago. People wanted to come here by train, but they said, what do we do when we get there? How do we get around? Well, we have the Steamship Authority and our buses meeting the train for a seamless transfer to all 15 towns. So you can get where you need to go, your final destination, quite efficiently now. But when it comes to older adults, the other factor too is, eyesight. Your eyes start to, it's a fact that as you get older, sometimes people need cataracts and things like that. So that's a factor to be considered, because one has to have all their senses, sharp as can be if you're going to traverse these Cape roads, which are antiquated anyway. So I think the whole issue with the AAA that you cleverly recognize is that the Barnstable County requires some special attention, and the Cape Cod RTA is trying to give it to them.
All right, awesome. Yeah, for those who are interested as well, we'll have another story up on CapeCod.com that has the numbers and the crash data linked a little bit more clearly for people who want to dive into that. I didn't want to just turn this conversation into just reading numbers at you, but it is with the context of Barnstable County being it's the oldest county outside of Florida, it definitely has a lot more bearing on this. But as well, so you've got a lot of things that have been awesome going on as of late that you've already highlighted. Good luck on getting the money for that new coordinator as well. As we move into the winter, do you guys have some general updates for me about how did the summer go? Were your buses full to capacity? How was ridership? And what are you looking for in terms of the holiday season that we're now working our way towards, if you don't mind me asking?
No, everything's great. We love it when you ask, because I just pinch myself every month when I look at our numbers, and our ridership continues to go up, and our new Smart Dart effort has really exploded. We introduced it earlier this calendar year, and every month there's at least another 300-400 downloads. We're up well over 3,000 now. We've got new go-card technology for fares, making it easier for people to pay their fare as they get on the bus, and just a lot of new exciting things going on here. So the Smart Dart is probably the one that I was most nervous about, because, we didn't know how that would be received. But every Sunday night I get a report, and every Monday Kathy indicates, how it's working in each town. And the wait time is what I'm concerned about. I don't want anyone to have to wait more than a half an hour once they summon one of our vehicles. And that's a big ask. But for all the months that we've been in place, it's been under a half hour. As a matter of fact, this week, it was lower than it's been all year, 18 minutes for wait time. So you can really get to those. Those are exclusive for each community. There's a B-bus in a smart dot bus in every town. So it can only take you anywhere in that particular community, but we can take you right to a fixed route bus and a free transfer onto a fixed route anywhere else on the Cape. So it's really creating efficiencies with the great team that we have here that really cares about making a difference and helping people. And it's, it's a joy to work with these folks.
Mm-hmm. Awesome. Now, I should probably clarify as well, this is sarcasm that I'm about to say, but have you received any threats from Uber yet in terms of the services you guys provide? It does seem like you guys are basically offering the ride share has really taken off in a few years. We have Uber and Lyft that has been the primary faces of the dial-a-ride service, but here you guys are offering basically the same thing for cheaper and with an only 18-minute wait time on average. That's frankly amazing. But yeah, do you guys feel like you're basically doing the community version of that better, cheaper?
Gray, it's amazing. You are an astute person interviewing us, because I think about that all the time. When people say, all governments are all saying, let's provide free this, free that, free transit, free this, that, and everything else. But we haven't raised our fares in 15 years. As a matter of fact, we've reduced fares where several communities have more than half their population get free fares at all times anyway. But because of all the additional services we provide and the sunk costs involved with transitioning over to some of the new software and things, there's a cost associated with it. But our Smart Dot is very much like Lyft and Uber. It's almost the same thing. Only the difference is we have drivers that are required to be trained, really trained hard and courtesy and safety, and they go through a rigorous training process, which I'm sure that Uber and Lyft make sure they pay attention. But periodically you hear of some sort of heinous problem that happened on one of those trips where it doesn't happen with us. So for $3, for a Smart Dart trip, for a transportation trip, it's a heck of a lot cheaper. For instance, in Bourne, if you're in Sagamore Beach and you want to go to Katomet, that's about 23 miles or so, 25 miles for $3. Try doing that in an Uber and Lyft. And it's the same kind of service. So, our drivers Corey checked too, of course, and along with our rigorous training process and drug test.
Yeah, I mean, you guys have a lot of accountability with that. I mean, that was kind of the conversation that started like, what taxi service kind of seem versus Uber, and it's like, well, one has a lot of accountability, but one's a lot more convenient. So it's interesting to know that you guys are also having the similar conversations and trying to provide the best service possible. As you're applying for more of these funds and as well considerations that maybe like Peter Pan like offered similar services that you guys do, of course, but as well with them possibly passing on that. The health destination service, that route. Do you think it's better if it's just that stuff is handled by the local communities CCRTA instead, in terms as opposed to Uber or Peter Pan? I'm sure they offer great services. Peter Pan buses I've been on myself many a time. But is it better if it's just that's a community run operation? You feel when it's the local authority who's in charge, kind of providing these community services like that?
Well, it's an interesting question, Garrett Grady. There are several buckets of funds that come from the feds, 5307, 5311, 5339. There's different pots of money. And, the private carrier, can access some of them. And that's what that 5311 has been going for years. It was P&B for years, then Peter Pan took it over. And they've all done, I think, a very good job. But when I learned recently that Peter Pan wasn't interested, I ran it by our team. And of course, they said, we could probably make it happen, but I think the state would have to alter what they presently plan to do with the RFP. So that's why I'm not sure that it'll ever come to fruition for us. But we would make it work like we do everything else and make it work successfully. So, and John, our general manager, and Kathy both think that, we could do it. We could probably do it. We've now, since the post-pandemic days, been able to hire enough drivers that have made us feel more comfortable about providing the service without cutting any service. We've never had to do that. But the driver shortage was impacting us where we were paying significant overtime, which alarmed me a bit. But we're back on good footing now, and everything is good. So, we're heading into the Christmas season, trying to get people to their shopping opportunities. I know that Kathy's got some marketing initiatives pointed to that effort. And, we hope we'll have a good holiday season with success and safe driving, and people take public transportation.
All right, awesome. Yeah, Kathy Jensen, Deputy Administrator, the secret mastermind behind a lot of the programs you guys are offering. So a big thank you to her, I'm sure. So we're about coming up on time, but is there anything else we wanted to highlight for our listeners while I still have you? Either some pride that you have, some exciting stuff for next year that you're keeping in the back pocket, or how have relations been with the state transportation agencies as of late? Do you want to take it as an opportunity to put some of them in the hot seat if maybe they haven't been as receptive as you'd like? Or do you feel that the state has been doing pretty good so far about this transportation opportunity that you guys have been trying to expand on?
No, we have a good relationship with MassDOT and the governor's office. I'm working closely with the lieutenant governor on, this initiative that will connect the Shining Sea Bikeway to the Cape Cod Canal, which is very, very exciting. And there's some relatively new wrinkles in that effort. And the lieutenant governor, called me last week, and she's definitely interested in what we're doing and wants to be helpful. She sent a staff person down here to learn more about our ideas, because we've offered to pay some of our federal funds towards that initiative, which FTA has encouraged us to do. Bike and ped is very much an important piece of the transit circuit here on the Cape. So that's probably one of the bigger deals we're dealing with as the new year comes in. But a lot of stuff we're watching, Smart Dot especially, because it's relatively new, but I'm extremely pleased with the way it's unfolding.
All right, awesome. Well, Tom, thank you so much for joining me for this conversation. Good luck into the new year if we don't talk to you again by then. And thank you for having this conversation with me, and good luck with all the services you guys are hoping to provide.
Thanks, Grady. And Grady, Kathy will keep you informed, particularly on the grant, because we anticipate hearing on that very, very soon.